Hello, everyone. Welcome to the Narcissism Decoder. I'm your host, Dr. Anthony Mazzella. Today, I'm interviewing Dr. John, a professor of psychiatry at the University of British Columbia and director of their psychotherapy program. His research focuses on a variety of psychotherapies and patient populations, with a particular focus on personality disorders and men's mental health. Dr. John also maintains a private practice. In this conversation, we explore several key questions related to narcissism. We focus on how narcissism operates as a fragile psychological system, one that oscillates between grandiosity and deep feelings of inadequacy. We cover a lot more, such as that which leads to internal fragmentation and identity diffusion. I didn't introduce that specific concept when I was talking to Dr. John, but this is where individuals oscillate between extremes, feeling exceptional in one moment and completely depleted in the next. There's no real stable bridge aside from the grandiose structure, which we'll talk about, but otherwise there's no stable bridge between those two different states. In part, this, and I'm quoting, oscillating, is what happens when the armor begins to crack. But again, we go into this in far more detail. Let me get you right into this first clip of our larger conversation so you can hear how Dr. John thinks about narcissism. Hello, John. Welcome to the Narcissism Decoder. I'm so glad that you're here with us because I'm really looking forward to talking with you about some of the deeper structures of narcissism and how it actually shows up in everyday life. So welcome to the podcast, John.
Thanks, Anthony. I appreciate being a guest on your show.
Great. Yeah, we're excited to have you here. So maybe we could start off in a really basic way. We know about narcissism, but we want to think about distinguishing between what we can call maybe healthy narcissism or healthy confidence. In other words, just for the audience, I read something that John published, and that's what we're talking about today. And in that publication, you described narcissism as really existing on a spectrum, right? Ranging from healthy self-investment to something maybe more troubled or some more vulnerable forms of narcissism. So I guess maybe that's a good place to start. When you're actually sitting with somebody, what tells you if they've moved like between healthy narcissism into something more, maybe what we could call defensive or fragile underneath that?
I think that continuum is a great place to start in understanding, like you were sharing just a moment ago, what healthy narcissism looks like. And this is something that a lot of people don't understand when we talk about the construct of narcissism. It's almost like it's a dichotomous construct. It's like you either have it or you don't. But that's not it. Narcissism reflects what you're saying is a sense of self-regard. There's an aspect of self-worth, healthy promotion, pride, and let's stick with the word healthy or
Mm-hmm.
adaptive. It exists in all of us. We all need some aspect of self-regard, self-worth, an element of self-enhancement to move us forward in life.
Mm-hmm.
And so, yes, people can be achievement orientated in a healthy way or an unhealthy way, and we'll get to that in a few moments. But without it, we just kind of stand still. We don't advance our own selves in life.
Mm-hmm.
But it's not just about ourselves. A healthy level of narcissism allows us to be realistic about who we are and our failures as well. The human condition is fraught with a sense of suffering and pain and failure, and it's not necessarily a reflection of somehow we're not good enough. And
Mm-hmm.
that's why these things might have happened to us. That's a part of life.
Mm-hmm.
Sometimes I try and I fail.
Yeah.
And so a healthy aspect of narcissism allows us to accept that. And it's like, maybe I tried this and it didn't work out the way I hoped or expected, but that's not a reflection of who I am as a person.
Mm.
And that's very important.
Bringing that part that I tried and I failed. So if I'm hearing it, correct me if this is a little off. So the distinction may be that in healthy narcissism, one can say that I actually tried, which is a big deal, like putting yourself in the game because you have to be vulnerable,
Yep.
and that I failed. So the failing part is also part of me, part of my sense of self. Whereas I guess if we look more towards the other end of the continuum, it would look more like what? That they just can't accept that they failed? Is that what it would look? Or insisting in their mind that they succeeded and that they've won or whatever the situation may be?
At the fundamental core of, let's say, pathological narcissism,
Mm,
problematic narcissism, is this fundamental sense of self of not being good enough.
yeah.
And how that manifests can look different for different people or differently for the same person in different circumstances and times. Sometimes, if a person tries and they fail, that's interpreted as another representation of how I am truly not good enough.
Mm-hmm.
Other times, and so that could be sort of looped into the our understanding of what a vulnerable presentation of pathological narcissism is like. But if somebody is, kind of in a what we would say a more grandiose state,
Mm,
where a conscious acceptance of a not good enough self is just, it's not there. We
mm-hmm.
are special, we are unique, we're better than, we surround ourselves with people who are successful, the best, and if I
Mm-hmm.
try something that didn't work out, that's not me, somebody else is going to own that because
Mm-hmm.
I'm
Mm-hmm.
so damn good.
Right. Okay. So let me think about this because you mentioned something now that I'm curious about because I'm thinking about some of the internal pressure that may go on with somebody who's suffering with more of this, let's say, pathological narcissism, right?
Hmm.
But what you're saying is maybe there's not such an internal conflict because their representation of themselves is what? When they have that grandiose structure, they always perceive themselves as being better, more than, right? So I guess that leads me to wonder, in your experience of it, or the way you conceptualize it, is there an internal tension, or where do you sort of see that going on in terms of the tension would be between what? I am the best or I am nothing, right? That I'm a loser. That's the more vulnerable part when they get into
Right.
that state, right?
These grandiose states are very tenuous.
Mm-hmm.
It's not like they're impermeable.
Mm-hmm.
When
Mm-hmm.
people do are presenting themselves as, in this grandiose state, they do need validation from others to keep that in place, to
Okay.
support that. That's the whole thing, with narcissism. There's this element of contingent self-esteem. I'm only good enough if others tell me so.
Mm.
And so when you're saying, I'm great, I'm good at these things, I'm superior, you actually need validation externally to confirm, to affirm that. But if you start experiencing invalidation or just it's not there at all, then that's knocking little chips in the armor, if you will. And eventually, for many of these people, the armor breaks and it exposes what their sort of true sense of self is. I'm insufficient. I'm not good
Mm-hmm.
enough.
Mm-hmm. Mm-hmm. You know, some people question, like, or they say, oh, the narcissist doesn't come in for treatment, or what would bring them into treatment. But it sounds like this may be the moment where they may be more open to getting treatment when they're in that more vulnerable state, when there's a, sort of chink in the armor. Because I would imagine when the armor is functioning well, meaning the grandiose sense of self, right? The grandiosity, they feel pretty damn good. There's no reason to say anything is wrong with them. Everything is wrong with everybody else at that point, right? Like if you think about someone who comes in, they present as they just got fired from a job. But if you try to explore what led up to them getting fired, it's always about, the employer or how they were too qualified, for instance, for the job. You see, that's when that
Yep,
grandiose structure, I would imagine, is still up and running. It's still functioning quite well.
absolutely. And in experiences where somebody fails and there's this kind of collapse of the armor and exposing this very defeated, vulnerable self, it's not that people necessarily will sort of go right into therapy because very often these experiences are absolutely humiliating.
Hmm.
And to go into therapy and then all of a sudden share what's happened, it's too much for them often. So very often there'll be a period where they're really suffering and suffering alone. And at some point, usually being prompted by somebody else in their life, they'll seek therapy. And it's quite common, like you were sharing, if they lost a job, well, it's not their fault at all.
Yeah.
My boss is an asshole, or actually I was too good for it. And so there has to be, from the perspective of the therapist, a very patient uncovering. Because if you jump into it too close, and you probably, with your experience and many other people, and it's like, I have a pretty good sense of what's going on here. If you jump into that right away, you're going to lose them.
Mm-hmm. Yeah, I want to go into that more deeply when we talk about treatment, because treatment, I think, is always valuable to consider also for people who are in relationships with
Mhm.
somebody who they think might have these characteristics, because in my mind, there could always be some overlap in terms of psychotherapy treatment and how one relates to somebody like this in their life, especially around containing and appreciating the subjectively useful component of something. But let's save that. We'll save that for now because I want to stick with this thought just for another moment. Because as I was listening to you, I had this sense of like, what's really lacking then to some extent, and I'm curious to get your opinion on this, is there's like a lack of internal cohesion, like based on the way that you're describing it. Like, in other words, it doesn't sound like there's like a continuous, stable, whole sense of self that they have. Like, sense, when I say sense of self, I mean self-esteem, self-worth, identity, the way they experience, their representations of themselves and how they imagine other people experience them. But that all sounds quite fragmented based on what you're saying. Does that sound right to you, or what are your thoughts on that?
Absolutely. I couldn't agree with you more about that.
Yeah.
Yeah. And the fluctuation between these states is something that's very disruptive and disturbing for people who do struggle
Mhm.
with the more problematic aspects of narcissism. Because at one time they can feel like absolutely nothing, and other
Yeah.
times feel like a hero.
Mhm. Yeah, I mean, it goes from what? I'm on top of the world to I'm such a loser.
Yes.
And that's I guess something we could also call, I think there are probably different names for it. I'm talking about it, that there's a lack of a cohesive sense of self, but that's also what's known as splitting, I would imagine, right? That's a split or a fragment, like they are internally in a way fragmented, that they can't integrate those two images of themselves.
Absolutely. And we'll get to the therapy stuff later, but that's a core aspect of therapy, is trying to develop a more cohesive, integrative sense of self where we can understand ourselves. It's, yeah, sometimes, I'll feel depleted, and
Mhm.
then other times very full. And then I can be that same person. Just in the same way, very simplistically, sometimes I can feel sad and joyful.
Mhm. Yes. And what you and I are describing now is sort of what goes on internally, right? Inside. And I don't even want to say inside the mind. I guess it's inside the mind because at some moments this stuff is very conscious, right? In terms of
Hmm.
how they feel. But what I was going to say is this deeper sense of fragmentation is not something one consciously thinks of, especially if they become pretty like skilled or an expert. Again, to jump back, I mean, to go back to what we mentioned earlier with blaming other people, which is a big part of, oftentimes people with personality disorders don't tend to see the problem as originated from in them, right? The problem doesn't come from within, it's external.
Correct.
So let's bookmark that because we'll pick that up again, that thread, when we talk about treatment. Because I would imagine, again, there are so many people out there who say that they're not treatable, but you and I are already talking about certain fundamental things that are going on. The grandiosity is a defensive, compensatory structure. Well, we could work with defenses. We've known how to do that, since, I don't know, the 1930s, maybe. And then the second part is splitting, which is also a defense, by the way, depending on how you define it. There are different ways to define splitting because there's a developmental theory on that as well, that we all come into the world split in a way, like if anybody listening has a child or if you ever had a puppy, you know how quickly they could go from being in a completely contented state of mind to crying and screaming and demanding. So that's kind of like a split as well, if you think about it, because they don't have an integrated sense of what we call object constancy, that they're
Hmm.
not yet able to hold in mind that the good is not completely gone when they're in this bad state. But anyway, so let's pivot because you touched on this briefly, but it's worth dwelling on just for another moment, I think. So we're talking about what's going on internally, but if we think externally, relationships become very important to these people, right? And you didn't use this particular word, but I think this is what you were getting at. But again, I want to get your thoughts on it. Is what we call narcissistic supplies, right? I'm not sure if you used that earlier, but is that, or some people call it, depending on what school, like theoretical perspective you're coming from, it can also be called a self object. I'm not sure if you're familiar with that
Oh,
concept,
yes.
but it speaks, or maybe you could speak to the importance that these external, I mean, we call them objects just because that's object relations theory, but people, external people in their life, like how important of a role do they play in maintaining this structure?
An absolutely critical role, because without these other people, their approach to soliciting, well, they need other people in order to get the external validation.
Hmm.
When people are struggling with problematic narcissism, they don't have the internal structure and internal support for their self-esteem. They can't feel good enough about themselves on their own. They
Hmm.
need others. And so a lot of the behaviors that they engage in are, in a way, unconsciously designed to solicit from others what they can't give themselves.
Hmm.
And
Hmm.
so if somebody's in a very grandiose state, as I said before, I'm superior. I can only relate with and associate with others of my station, if you will, others who are excellent, superior,
Hmm.
the dominating kind of behaviors that can sometimes be present. Well, that's my sense of being better than others. Or if a person's in a more vulnerable state, they may be very self sacrificing, giving myself, being like a martyr in order to draw from people how good I am. And so, in all those different ways, the role of others is absolutely fundamental for these people who are struggling with problematic narcissism, in order to feel good enough, at least for a little while.
Yeah, okay. So let's see if we can sneak something else in here. If it fits, you'll let me know. But the other, I used this word just a couple moments ago, like when you think of object relations theory, but the word object's a really important one because the other is not really another person, like a whole person with their own thoughts, feelings, and behaviors that's
Right.
separate from their own, right? So to some extent, I would imagine that we also, because we're setting the stage, not like this is our big, like finale, but for we're thinking about treatment. My eye is always on like how do we help somebody like this? But I think it's probably important as well to consider self other differentiation. I imagine that's something that they struggle with. So if the other person is separate from them in any way, I mean, yes, not giving them the supplies that they need, the validation and everything that you just described so nicely, John, but also if they express a different opinion, right? If they want to go out with their, like I'm thinking of a woman maybe who wants to go out with her girlfriends on a Friday night. I imagine that too could create some sort of discomfort in somebody who's struggling with these tendencies.
Let's take a quick break.
Are you tired of feeling like you're walking on eggshells all the time? Do you feel drained, confused, or like nothing you do is ever good enough? Are you stuck in a cycle of elation, then criticism and confusion? If any of this sounds familiar, you're not alone. And that's exactly why I created Office Hours with Dr. Anthony Mazzella. That's me. Office Hours is a low-cost, small group space where you could bring your questions about narcissistic traits and dynamics and the places where you feel stuck. You'll be met with honest, grounded feedback. I'll hold the group with structure, but there's also space for a real conversation. This is a space designed for anyone looking for clarity, insight, and support. If that sounds like you, just click the link in the show notes to join us. Okay, I hope to see you there.
Absolutely. And that's a very important point that you brought up, is that a person struggling with narcissism cannot see others in their entirety, as a whole self, as an independent, autonomous person with their own thoughts and perspectives and attitudes, which may actually be in contrast to attitudes and values and thoughts that you have. They
Mm-hmm.
are seen through the lens of functionality. What
Mm-hmm.
can I get from you that I need? And that's it. If you go beyond that to think about the whole person, beyond just the objects that they're typically engaged as, then it's too threatening. Oh, this person may disagree with me about something. Well, that's really hard for me to tolerate.
Hmm.
If I see them as a whole person, I'm then exposed to the possibility that they may be better than me at
Mm.
something. And that's not tolerable either. I can't risk seeing them. This isn't conscious. These are unconscious processes, but it's like that's the difference between whether we see somebody as a whole person or just see them as agents, if you will, for what they can give us.
Yeah, it's so interesting because you didn't use this word again specifically, but it brought to my mind envy, and there's something
Uh-huh.
that's known as like destructive envy, where if they do recognize somebody for all of what they could give, that's like for, again, anybody listening who's with somebody like this, they know this very well. And if they don't, you could pay attention to it. How often do you hear thank you or I'm sorry? Like, do you ever get an apology? You see, because to get a thank you, just something as simple as thank you is hard sometimes for these individuals in a genuine way because it means you've enriched my life. But if you enriched my life, that means you've given me something that I don't have, which then implies you had something that I didn't have. And that could bring up this concept now of envy, right? That they could become very envious then, because that's a reminder that they are lacking something.
Yes, and so if you pair that, we all feel envious, but if you are stuck with a core sense of self that is really shaped by shame, to feel envy, oh, that envy it's destructive.
Mm-hmm. Yeah, or to go back to what we said before, just to tie a couple things together, if there's not that stable, cohesive internal structure, what we called object constancy, or something that just holds the self together so it's not fragmented or split in the way we were describing earlier, then we could see. I'm not condoning the behavior. I always have to make that very clear, but it becomes a little more understandable that they relate to other people in the way that you and I are describing as objects or need gratifying people, like they're there to gratify a need. But when you think about it, it's like the air that we breathe, like they need it to stabilize what could
Yes.
otherwise then be a very fragmented sense of self, which means they could feel like they're literally falling apart to some extent without that.
Yeah. And I'm glad that you brought that up, and I understand your cautiousness about not wanting to appear as condoning, but that understanding of others is so important. And it's because, the term narcissism or narcissistic, it's pejorative. There's connotations within society. We never use it in a positive sense whatsoever.
Mhm.
It's used very often as an insult or to define an extremity of somebody's behavior, like to say somebody's really narcissistic, that's bad. But
Mhm.
it's not like people who struggle with these difficulties are intentionally engaging in them. And so if we have somebody in our life, whether through work, from family, friend, that is like that, it's easy to dismiss them as a narcissist.
Yes.
But they're a person. They're a person who's struggling. Sometimes it's very difficult to appreciate that struggle,
Yeah.
but conversations like this and what you were just saying a moment ago helps us understand that person better, which
Mhm.
allows us to engage with them in a different kind of way.
Yeah, and I'll just give one caveat to what you said, and you tell me what you think about this, okay? They don't intentionally do this, except or aside from, there are different types or presentations of narcissism, and one of them is known as what we call the malignant
Mm,
narcissism. So I always, in my mind at least, see them in a little different way because there is, they call malignant for a reason, which means they may be a little bit more conscious of the way they manipulate people or try to extract something from them. But I'm curious if you think about it that way, John.
I do, and it's good that you brought that up because, very often these are the folks who are the most destructive because they do have some conscious attunement to doing these things.
Yeah.
And the destructiveness is not necessarily something that they feel, it's what others around them feel.
Yeah. I've learned to be sensitive around that because the podcast, where you and I are recording right now, has been around for a little over 2 years. And in my early days, I would leave that out. And I had to really reflect on
Okay.
why would I leave out the conscious motivation of someone to be so destructive? But I think the truth is, I don't see those kind of people so often in my practice. I think they're less likely to come in for help. than your sort of garden variety, if we could call it that, narcissistically disturbed individual. They're more likely to come in, whereas the malignant is not. So I think that
Yeah.
sort of lent to some level of bias that I had early on in my podcasting career.
Yeah. Well, it's good. You learn something from doing it, right?
I learned from my audience, kind of like I learned from my patients as
Yeah.
well. I mean, that's part of practicing. But let's talk about patience and practice. This is a good place maybe we could transition. In this first segment, we begin to map out the internal world of narcissism, not as a fixed label, but as fluctuating. It's a fluctuating structure shaped by vulnerability, fragmentation, and the ongoing need for external regulation. We looked at how grandiosity can function as a kind of psychological armor, how it collapses and exposes a deeply vulnerable self, and how this instability often plays out in relationships, where others are experienced more for what they provide than for who they actually are. In the next segment, we'll move more directly into the clinical space, what this looks like in treatment, but also how these same patterns show up in everyday relationships with partners, friends, and in those small moments of tension or disconnection. We'll look at what it takes, both in therapy and in real life, to begin building a more stable, integrated sense of self. Disclaimer alert. The Narcissism Decoder podcast is provided for general information purposes only. The content presented in this podcast is not intended to diagnose, treat, or cure any psychological condition related to narcissism. The content on this podcast should not be considered a substitute for professional medical advice, diagnosis, or treatment. For specific advice pertaining to narcissism or any other psychological condition, you could reach me directly. I am an experienced mental health practitioner who is always taking on new patients. If you would just like a consultation, I can do that too.